So as you could guess from the title, this is a little bit different. So you all know about 40 flow MRI, which we're using to look at aortic blood velocity and quantify flow. And also Cine MRI, which we can use to see left ventricular volumes and valve movement. And what's probably a little less familiar is a signal called the Seismocardiogram, or the SCG. This could be intuitively understood if you just put your hand on your chest. You can feel your heart beating. So we record those accelerations and then just do a little bit of processing to try to understand some things about heart function from that. So this is just an example of what an SCG signal looks like through one heartbeat. And it's not used clinically as far as I'm aware, but I'll just show you a clinical scenario that can help illustrate why it might be of interest. So here's a subject who has a bicuspid aortic valve. You can see the valve and the stenosis. And the subject went on to have the valve replaced with a mechanical valve. There it is. And so before the replacement, there was the characteristic jetting flow from the stenosis and the swirling through the arch. And after the replacement, there's relatively normal flow function that's been restored. And we have the SCG recordings from before and after, and I'll also overlay just the MR flow quantifications. And so you can see before, when there's sort of compromised flow, there's something that's a little hard to pick out, so we'll look at a spectral decomposition of it. So the horizontal axis is still cardiac time, starting with the R wave going through systole. And we're seeing some elevated energy in the SCG signal that shows up through systole. And after the valve replacement, that energy is gone when the flow has been restored to normal. There is a more intense valve closure, as you might expect with a mechanical valve. And you can support this kind of interpretation by looking at the 40 flow streamlines through the cardiac cycle. So I'll save the rest. Please come see the poster. But basically, we've collected data from about 30 healthy individuals, both in MR and in SCG. And we've looked at correlations between metrics in both modalities. And we see some pretty interesting differences that suggest that we could use SCG as a very quick, very easy screening tool that could refer people for a more thorough examination to find out what sort of abnormalities they have. So please come visit me at poster number 20. Thank you.